All right, right now, nearly 93,000 people are hospitalized with COVID-19. That's the highest number since January. President Biden is ordering nursing homes to vaccinate their staff in order to continue receiving federal aid, and that also includes federal Medicare and Medicaid. This will affect nearly 15,000 nursing homes and 1.3 million workers. Currently, nursing centers with Medicaid and Medicare services report that 62% of workers are vaccinated. And states are also cracking down, requiring teachers and school staff to get fully vaccinated, including California, Washington, New Jersey, Oregon, and Connecticut. So booster shots, or a third dose of the vaccine, as some are calling it, will become available September 20th. That's for fully vaccinated adults over 18, pending FDA approval. But there's important information that you need to know ahead of time. So we've asked Dr. Jonathan Kantor, an epidemiologist at Penn Center for Global Health, to break it all down for us. Dr. Kantor, thank you for starting your day with us today.
Thank you. Great to be with you.
So let's jump right in. More than 1 million people got shots in one 24-hour period this week, and that's the highest number in almost 7 weeks. But some people are still hesitant because the vaccines aren't yet FDA approved. So when is that expected to happen, and do you think that will change any minds once it does?
Yeah, I think the full FDA approval, I think, is something that is really lacking. I think, in some ways you could argue that this reflects a failure of the entire system. And that's not because it's so critical from a doctor standpoint that the FDA provide full approval. It's because that's something that a lot of those who've been hesitant about the vaccines have been hinging their concerns on. So you'll hear a lot of people say, well, it's not really FDA approved. It's just an emergency use authorization. In fact, we've seen that even in terms of governmental entities. For example, the military, one of the reasons that they talked about pushing off their requirement for all service members to get vaccinated until later next month is because they're trying to wait for full FDA approval. Similarly, businesses are in a bit of a bind because they are in a situation where they want to force essentially their workers to get vaccinated, but at the same time, the workers can push back and say, but it's not even FDA approved. It's just an emergency use authorization. For all intents and purposes, from a safety standpoint, it's basically the same thing. Everyone that is suggesting that we're going to hopefully hear about that maybe later this month or next month. But again, we don't have firm signals on when exactly that's going to happen.
So once it does, do you think people will start running out to get shots, or is it going to be the same thing? They'll come up with another excuse like, well, and just come up with other stuff?
Yeah, I don't think that your local Rite Aid or Walgreens or CVS is going to have a stampede going on once the FDA authorization comes in. I think you're hinting at a really important principle, which is that a lot of the people who are saying that they're waiting for FDA approval are using that essentially. It's sort of like if you don't want to get up in the morning, then you'll say, oh, well, I got to bed late last night, or well, I'm going to get up early tomorrow morning. So there's always going to be something that's going to keep you from doing what you want to do. Humans are, rational, but we're not really rational. Often we decide what we want to do, and then we rationalize what we are doing to align with that. So I think if people don't want to get the vaccine, they may rationalize that by saying that it's not FDA approved. The problem is once that FDA approval comes through, you're making a fantastic point. They may go and just shift to finding another excuse similar to not wanting to get out of bed in the morning.
Yeah, well, let's hope that's not the case. But what would you say are the recommendations on how soon people should get a booster shot? It'll be available next month. And what is the criteria? I know it used to be anyone who had underlying health issues, but now they're saying all adults over 18 that have already had the vaccine.
Yeah, this was a rapid pivot, because it was only a few days ago that we were talking about the fact that they were very clear in saying not only that you had to be immune suppressed, but that you had to be immune suppressed to a degree similar to somebody who'd had a solid organ transplant, which is pretty darn immune suppressed. And next thing you know, basically 72, 96 hours later, they're coming out and saying, hey, boosters are going to be available to everybody. So it definitely was a major pivot. In terms of what the recommendations are, they use this period of 8 months after your second dose. And so it's not that everybody should go out September 20th to try to get their third dose. It's that September 20th is when the period begins. So for example, if you had your last vaccine January 20th, if you were one of the early adopters, that would be the appropriate time for you. Otherwise, it would be basically rolling based on when your last dose is, 8 months afterwards. And again, the recommendation now is essentially to make it at least available to all adults. I would personally suggest that I will be getting it myself. So I would suggest that for all adults, we do know that it probably provides significantly more protection. And even though this has been a little bit controversial in terms of pushback from the World Health Organization regarding who should be getting third booster vaccines, when you've got entire countries that essentially have almost no vaccine,
Right.
regardless, given the fact that you can't personally shift your vaccine dose that we have here in the United States to another country, there's been some discussion about the ethics of it. It probably is appropriate for those who are eligible to go out there and get that third vaccine.
Doctor, real quick, we only have a short amount of time left, but I want to get to those Johnson & Johnson people. Now, originally we're hearing that people who had 2 doses of Moderna or Pfizer will get the booster, but what if you only had 1 Johnson & Johnson? What happens to you?
Yeah, there's essentially been silence on this issue. One of the justifications has been that the J&J vaccine was approved later, so that there isn't as much data, there isn't as much time. The other thing to keep in mind, and this is something that people aren't really talking about, is that mechanistically, a vaccine like the Johnson & Johnson vaccine, that's an adenoviral vaccine, it doesn't always work the same way with boosters. Sometimes boosters aren't quite as effective for those types of vaccines. I don't know. I don't think the data's out yet to know with J&J if that's going to be effective. But the question is going to be, should those people go and pivot perhaps to one of the mRNA vaccines like Moderna and Pfizer, or are they going to suggest another Johnson & Johnson vaccine? We'll see what those data come out probably in the coming weeks.
And real quick, can you mix and match? Can you get a Johnson & Johnson the first time, Moderna the second time, or Moderna the first time and Pfizer on the booster? How does that work?
So in terms of the actual suggestions in the U.S. right now, the suggestion is to stick with the type of vaccine you have had.
Okay.
We do have data coming out of the U.K., for example, where they actually suggest that mixing and matching may actually be beneficial. Personally, I would suggest that if somebody has had a Johnson & Johnson vaccine for their first vaccine, that they certainly, if they talk to their doctor, strongly consider doing a Moderna or a Pfizer as their second dose, at least with the data we have right now.
Dr. Jonathan Kantor, thank you so much for starting your day with us. Very important information there. We'll be right back.